is Lisa Langford. I'm head of accelerators for Turn.io, South African by birth, but based in the UK for the last few years. So it's currently quite cold and rainy. I hope it's warm and cozy wherever you are in the world. I'd like to welcome you to Demo Day today. This has been the culmination of 6 months of really hard work. But before we get started, just some house admin. I ask that you keep yourself on mute. There will be ample time for questions. At that stage, you can raise your hand, pop a question in the chat, or unmute yourself. Keep your video on. We love to see the smiley faces from all around the world. And lastly, best of luck to the cohort and everyone involved. I think this is going to be an exciting day today. So with that said, maybe a little bit of background before I hand over to some of the speakers. Over the last 6 months, the organizations you'll see today have built and tested refined AI-powered WhatsApp services for primary and community healthcare. They've moved from early concept to working services used by patients and frontline teams across the globe. And today, you get to see the amazing work that they have done. But without further ado, I'd like to hand over to Gustav Breikholt, our co-founder at Turn, to welcome you.
Hi all. Amazing to see so many people that I know, and I'm really excited to see the work. I think you guys are going to enjoy it. And we have a great turnout, more than 100 people in the room. As always, we are here because we are unified in our approach and our goals to create affordable, high-quality healthcare for everybody on the planet. I can't believe this, but it's now the 8th accelerator that we've run, starting during the dark days of COVID, when we wanted to help organizations and provide them with the support and the technology to scale their impact. I think what has been really interesting is this particular cohort has been super interesting because of the wide variety of different approaches that the organizations have brought. By far the widest variety of applications we have, from diagnostics to primary healthcare, telehealth, women's health, audiology, vision. It's just been really, really interesting to see how people use this combination of abundant intelligence or artificial intelligence combined with global distribution, at least global south distribution. I think it also came at a really interesting time. We know last year was really tough on many levels for the work that we're doing right now. So on the one side, we are in a really dark place, with a lot of funding having left this space, especially the social impact arena. On the other side, we have this incredible opportunity with AI models just improving day by day and week by week. Just the last 2 weeks, OpenAI has launched their health product. It's been so much exciting work, and it's really been interesting, even during the 6 months that this accelerator's been going, the improvements in the models. And I can't wait for you guys to see the amazing work these teams have been doing. I'm not going to talk long. Mostly, I just want to thank people. Firstly, just the amazing teams, the incredible work that you do. You inspire us every day. It's nothing more fun than to grab my phone and to see the latest thing that One Day or Peak Vision or one of these organizations has come up with, another way that they've figured out how to use these tools. Then obviously the funders, it wouldn't have been possible without them. I see Kenichi's here from Mulago, Sarah's here from Johnson & Johnson. Thank you so much for the support that you guys have brought, especially in this year when so much funding went out of the space. And not only for funding this kind of program, but also the ongoing support that they provide to organizations like you. Of course, we couldn't be here without OpenAI and the amazing support. I see Alex is here. This is the second accelerator that they've supported, and obviously being pioneers in this field, driving the LLM revolution in the first place, and then just keep on bringing these incredible models that have made this work possible. And I think ID Insight is also here. They've been providing a lot of technical support for the team. And of course, our own team, starting with, on my left-hand corner, Lisa, Sophie, I see Indrani, Manish, and all the other people in our team that have been supporting these groups. So I think that's all for me. I'm going to hand back to Lisa, and I'm really excited to see the work. And just thanks again for the amazing work.
Fantastic. Thank you, Gustav. Yeah, I think just to echo, without the partners, this would not happen. So let's hear from Sarah Malone, who is a director for health innovation at Johnson & Johnson, and why are they even interested in partnering in this kind of work? Over to you, Sarah.
Thanks, Lisa. And actually, maybe we'll continue that echo of thanks. Just a huge thank you to the collective vision, the tenacity that exists on this call. It's really you on this call that makes the work that I am privileged to support through the Johnson & Johnson Foundation, you make it real. And when I say real, it means making the work that we're focused on healthcare workers, equipping them, connecting them, advocating for them. You make it happen. And so I just want to really share that thanks for everybody on the call. And with my role, it's really focused on making sure that innovation isn't a privilege. And again, everybody on this call is so committed to that it makes me even more excited for this demo day. And why this program? We've always been so inspired by the work that Turn does. But again, on that feeling of making it real, you've spent 6 months of hard graft together, really getting in the weeds and creating something. And that's so very commendable. It's so impact focused as the second piece. But the third piece is really about this peer-based approach as well. We truly believe that magic can happen when you bring many minds together. And I'm sure that has happened as part of this cohort. So lastly, I'll just leave you with genuinely extremely excited to see the innovation that you're pushing forward, ensuring it's not a privilege so that we can serve the underserved. And please remember that this is about progress, not perfection. So there is so much progress that needs to happen in this space. It's okay to not have it perfect right now. It's still going to be a step forward in the healthcare worker space and the health space in general. Back to you, Lisa.
Thank you so much, Sarah. Thank you. And now let's hear from Kenichi Nosaki, who's based, and I see it's still very early there for you, Kenichi, wherever you are in the world today. Maybe share a little bit about the Malaga Foundation and why you helping and supporting this program.
Yeah, of course. Thanks, Lisa. And thanks for everyone for being here today. So yeah, indeed, we're based in San Francisco. So it's a little early, but we've been a partner with Turn since 2019. And so with these accelerators, in this one in particular, we see it as a way to supercharge health solutions in low resource settings, get quality care to the people in most need. And as Gustav pointed out, health systems are under increased strain, especially the lasting and painful aid cuts in the past year. But Mulago believes that even in these times, you can still design, deploy solutions that deliver high quality and low cost care at scale. As you know, we're obsessed with consequential impact that customers can actually pay for, and Turn's an awesome partner to really enable this. So this accelerator in particular, which features a couple of Mulago partners, which I'm excited by, integrates AI with WhatsApp to create a powerful delivery layer for providers. Again, with the goal of improving quality while pushing costs down to an ultra low price point. So practically, this looks like primary care shifting from a physical model to a hybrid one, AI supporting triage, booking, follow-up, and adherence, routine consults moving to telehealth, and follow-up messaging improving outcomes for chronic care and antenatal care. So just to sum up, yeah, this cohort shows what's possible when proven health providers are supercharged with the right and latest tech. The work you'll see today is practical, scalable, and ready for real world deployment. So we're really excited to be here, and thank you.
Thanks, Ganesh. And then lastly, we can bring everyone together, but if we don't have the technology and the technology partners, then it will take a long part and time for us to get there. Alex, second time involvement from OpenAI, as Gustav mentioned, lots going in your stable. Share with us your thoughts on health and also why OpenAI is participating in these kinds of partnerships.
Yeah, thanks so much, Lisa. And hi, everybody. I'm Alex. I lead OpenAI Academy. A big part of my work is meeting with nonprofits around the world and supporting them as they learn how to explore AI to advance their missions. And as you probably know, the vast majority of organizations are really just beginning their work with AI, maybe using AI to, draft emails, But a handful of organizations like the ones on this call today are far beyond that, building thoughtful, high impact AI-powered solutions that are actually responding to real needs on the ground. And something that I believe that my colleagues believe as well is that the health sector represents one of the most powerful opportunities for AI to create human impact. The challenges are very complex and the stakes are really high, but the potential upside is enormous. And that's something the leadership team at Turn.io realized really early and why we were excited to be invited to support this work. So on that note, would just like to thank the team at Turn.io for running another outstanding program, as well as all the partners and funders who helped make this work possible. But most of all, just want to thank and congratulate the organizations that are presenting today and helping define what's possible and what's going to be responsible and effective AI in global health. So congrats on everything you've built so far, and can't wait to see the presentations today.
Amazing. Thank you so much, Alex. Well, now it's the best part. All the formalities are done. Let's give the stage to the ones who deserve it. What you'll see today, you're going to see 3 sets of demos presented. There will be time after each video for you to ask questions. So don't worry if you get excited, write that question down or even pop it into the chat. Once the first set of 3 has played, we will stop, we will have a discussion, and then we'll do the next. So enjoy, everyone.
Over 1 billion people worldwide live with vision loss, yet 90% of cases are treatable. Peak Vision is on a mission to bring better vision and eye health to everyone. Our software helps eye health providers find patients with accurate smartphone screening in schools, communities, and workplaces. Our data capture platform then helps track and follow up those who don't make it to care, so no one is left behind. Today, Peak works with eye health partners in 13 countries. Together, we've screened over 18 million people for vision problems and connected nearly 2 million to care. Screening is done by community health workers, teachers, or volunteers. Specialist eye health teams then triage and act on the data they receive.
Our ambition is for our partners to screen 1 million people per week using Peak. That means rapid growth with frontline teams using Peak consistently and confidently. Demand for onboarding, training and support at Peak is growing faster than we can deliver. Human-led support does not scale, so we needed a new model, and that's where Turn comes in.
Turn is a core scaling enabler for Peak, extending and not replacing how we support partners. Using Turn's new AI integrations, we launched Peak Assist through WhatsApp, meeting frontline teams where they already work. It delivers instant answers in 4 languages, grounded in a curated knowledge base we've structured from our internal resources. Working with our data science partners at ID Insight, we've kept iterating to improve reliability, so routine questions are handled quickly and complex cases reach our teams.
We have learned a huge amount through the accelerator program with Turn. One lesson that stands out for us is without good data, there is no good AI. The quality of our training content has had the biggest impact on our performance. Success for us, it isn't about the user numbers, it's about end user resolution rates and reducing the workload for our teams internally and our partners so that we can scale together. During the last 2 months, we tested the Turn-powered chat with 142 users across 5 countries, and the feedback has been overwhelmingly positive. We now want to embed Peak Assist in all programs across all countries, using a staggered approach and building in time for feedback, evaluation, and iteration. So we anticipate that each team member will gain at least 130 hours of productivity per quarter, which we can then use to onboard new partners, reaching more people who need access to vision care.
Hi, I'm Lila from WISA. We provide an AI-powered solution stack for end-to-end mental health support, focused on prevention, intake, and therapy adjuncts. While we are proud of our clinical evidence and global privacy rankings, our core mission is simply to make mental health support accessible to everyone, everywhere. We've covered 11 million lives and processed over 300,000 NHS referrals. However, we've noticed a critical barrier. Traditional intake forms have a completion rate of below 70% for non-English speaking groups. These users face literacy barriers, phone anxiety, and require mobile-first native language solution. By building on Turn.io, we've turned WhatsApp into a specialized clinical engine. Our new digital referral assistant enables multilingual voice-enabled intake. We've developed an AI agent capable of navigating the entire intake form and uses selected language with full voice support to maximize accessibility. Our GTM strategy identifies NHS services with high non-English demand. During this accelerator, we learned to navigate governmental strategic patients. Because we face compliance blockers for e-triage, we applied our learnings to a different use case, DreamKit in India. For DreamKit, we launched a pilot in 2 languages, Marathi and Hindi, audio-visual journeys within weeks to provide resilient skilling via WhatsApp. By pivoting from a passive broadcasting to in-person orientations, we saw 85% read rates and high engagement. This validates our path for multiple use cases beyond clinical triage. Our plan is to scale DreamKit's success and do this while we're deploying standardized conversational health template for the NHS triage.
Hi, I'm Tasha de Kock, Director at the Eurix Foundation, a non-profit born out of the Eurix Group, a global health leader in digital hearing health. We translate cutting-edge hearing tech into community impact. Our mission is simple. No child should be held back by preventable or undetected hearing difficulties. We work where the need is greatest, bringing solutions that unlock language, learning, and life opportunities. We use a high-tech, soft-touch approach, empowering community members with evidence-based digital tools for prevention, detection, and intervention. The need is urgent. At any given time, 1 in 10 young children have undetected hearing difficulties that impact their speech, language, socio-emotional, and ultimately educational outcomes. Yet, awareness and action remain low. Healthy hearing is the gateway to healthy learning. Prevention starts in the classroom. We equip teachers to spot issues early, connect families to care, and support identified learners. We successfully piloted WhatsApp-based training with 2,500 teachers, showing significant knowledge gains, thus making it our ideal path to scale. During the accelerator, we built 2 Turn.io applications, an AI-enabled hearing coach for new hearing aid wearers, and an automated AI-enabled teacher training for primary prevention of childhood hearing difficulties. We invite you to experience our new service firsthand. Participating in the accelerator was transformative. With guidance from the remarkable Turn team and partners, we learned to create automated AI services from scratch without any prior knowledge of the platform. We embraced user-centric design and optimized for scale. Chat and AI moved us from manual training at a 1:30 staff ratio to training unlimited teachers simultaneously. We upgraded support from occasional to 24/7, and our BigQuery integration delivers actionable data and tracking. What excites us most is impact, captured in teachers' feedback after completing the training. Our go-to-market prioritizes scalable partnerships. We'll phase rollout through existing education and community networks while building national and international partnerships, starting in Africa and Brazil. This is just the beginning. Our first goal is to train 150,000 teachers, reaching 4.5 million children annually. We'll support new hearing aid users with our Hearing Coach bot, extend training to caregivers, teens, and lay health workers, and develop research tools to amplify impact. Join us to make healthy hearing accessible to all. You can partner on rollout, help validate at scale, and fuel the next wave of chat and AI-enabled community hearing care. Thank you.
amazing. Well done to the first three organizations, Peak Vision, Wiser, and HearX. I'm now going to open the floor for some questions. I'm sure you all have some already written down. The team is here and available to answer any questions. So maybe if you want to put your hand up or pop a question in the chat window is also an alternative, or maybe unmute yourself if you have any questions. I see Fosca has got a question.
Yes,
Fosca.
thank you so much. Hi, everybody. I am Fosca Tumsare from Uganda. I hope you can hear me.
We can. It's a little bit soft, but if you speak slowly and clearly, I'm sure we can hear you.
All right. So I love everything that I have heard about AI, Pan.io, and health. But my question is about governance. How are we dealing with the governance end of things? How are we embedding this into national plans, the policies, and also what is human resource required and the financial resources that are required to have models that are actually working? Thank you.
Fantastic. Thank you, Fosca. Just to recap, Fosca, and this is maybe a question for anyone in the cohort would like to throw through, is how do you think about governance? I know there's been a lot of conversations going on in terms of digital public infrastructure and goods. Have you had any thoughts on the governance that you've engaged with in the territory you've been using? So any of the cohort members want to take that question? I think maybe we'll pass that question for now, unless, Leela, I see you here. I know you're going to speak a bit later. Not so much governance in the sense, but perhaps you can speak about government partnership and having to be compliant to engage with governments. I know specifically the work that Wiser has done. Maybe you want to chat about that. That's Lila from Wiser. Yes.
Yeah. So I guess the difficulties we had with kind of working with government or public sector was data residency and trying to ensure that the data residency for in terms of governance is acceptable, and we ran into trouble there because actually the turn is in the US, and the data residency for any UK products, public sector need to be in the UK. So we did have difficulties there in terms of trying to use our product in the NHS. Although the demos that we did, and there was lots of excitement around it, we haven't quite yet worked out how we're going to manage the governance of working with like a UK or the UK NHS public sector.
Fantastic. Thank you, Lala. Yeah, definitely something to consider. I see Samir from Helium has got your hand up as well. Do you want to take a stab at that?
Yes. Yeah, so in terms of data governance and privacy, we've also had several experiences. We have Helium Duck in Qatar. We're also trying to validate one for Helium Duck Nigeria. So we have to comply with local laws. So for the Middle East region, and there's also one for Nigeria, the NDPR, to comply in terms of storing data. Where is the data stored? Secondly, we also look at things like, third-party data access, especially use of AI with personal identifiable information. So we have to kind of, be mindful of strict compliance to that. So also making sure that we put out the privacy policy and make sure the users are well aware of it, before they use the service. So those are some learnings I've had.
Fantastic. Thank you so much for that. That's really relevant. So I think regionally is really important to consider that. Nick, I see you've got your hand up as well from Peak Vision.
Yeah, so I mean, at Peak Vision, we have always taken an approach where we have data processing agreements in place with all of our partners, including government partners. And it's really important they are the data controller, is their data, and that they know how it's being used and can say how they want it to be used as well. So when we process that data and we process that data via AI models, then they're always it's always important that they understand how we're using that data which they own on behalf of their citizens, and also adhering to standards like GDPR and ISO 27001 combined with local laws as well. Just make sure that we're covered when it comes to those sorts of questions. So it's something we've built in by design to everything we do, and that's all the more important as we begin to utilize AI going forward.
Fantastic. Thank you for that, Nigel. I've got a question here that I'm seeing, and maybe the team at Heurix can answer this for us. So maybe tell us how your AI integrations have enabled you to scale solutions with partners. Sasha, you had a strong video there, very strong on partnerships. Maybe you'd like to share a little bit more on that.
Oh, thanks, Lisa. Yes, I think at the foundation we're so excited because of this fact of automation, and that we could actually integrate AI that allows our users to interact autonomously with this AI agent. Has really been the key factor that has enabled us to scale with partners now. And we're looking forward to new partnerships with the Clinton Health Access Initiative that work with school-based screenings in multiple countries to embed this teacher training together with those rollouts, as well as a national campaign called Hold My Hand. That's an initiative by the South African presidency to really reach children under the age of 5. And then we're also really excited about launching our training officially on the 3rd of March, together with an international day called World Hearing Day, initiative by the WHO, where we're a partner. And it's just a perfect time because the theme this year is from communities to classrooms, ensuring that every child can hear. So perfect alignment with the work, and we look forward to taking it further.
Fantastic. Thank you, Tish. I see here's a question from Vim Low. Vim, do you want to unmute yourself and maybe ask the question? Maybe Vim is not able to, which I'll just repeat here. So this is a question for any of the co. In terms of providing users with health advice or guidance, how have teams managed user expectations and LLMs generating incorrect or misleading information, as it occasionally does? How have you found users are used to interacting with AI and expect it to happen sometimes? Any of the cohort team members want to take that one?
Lisa, I'm happy to take that one. So for Peak Vision, it's been slightly different in terms of how we've provided a service to our end users. The way that we have trained our AI chatbot is in our own software training. So we have ensured from an internal perspective that the content accuracy has been our highest priority, because if the content is not accurate, our end users are unable to use our software. So we have employed quite rigorous internal processes for testing. But I think transparency, when you're using any AI service, there are always opportunities for AI to hallucinate. And we have been
very transparent with our end users and built in communication into the service to say, this is an AI chatbot. It is subject to making errors, and there is always an opportunity to escalate queries to a human. So we've definitely been, I think that transparency, I think we've got a responsibility to be very transparent with end users, rigorous testing processes internally and externally with end users, and ensuring that there's always a human in the loop. I think they're the key things that we have focused on.
Fantastic. Thank you, Gronya. I almost feel like I need a t-shirt that says human in the loop. I think that is going to be the one thing that all of us need to continuously consider. So yes, Mert, go ahead.
I also just wanted to add in that there's also a bit of a toss-up between accuracy and latency as well. We have a selection of models to choose between, like nano and mini models and thinking models. So depending on the use case, if it needs to be something that's very quick and responsive, you might lose some accuracy there. So we experimented with this approach as well.
Amazing. Thank you. Julia from Cleniva, go ahead.
Yeah, to add on the same question. So we realized very early on that users are not really comfortable with AI making mistakes in healthcare. And so trust almost has to be designed deliberately and separately. And kind of safety accuracy becomes a trust problem rather than a technical problem. And that's why from the beginning, it was very important for us to set the framing and the expectations and really positioned our solution not as a clinician or authority, but more as a support layer. And then the next thing we spend time doing is really constraining what it's allowed to do, right? Very narrow domains, short responses, clear handoff to the clinician where it's critical. And from user research, we realized that at least in healthcare and in our setting, the users don't really think about it as an LLM AI hallucinating. It's more about where does their care break. And I think it's quite relevant with all the latest discussions around ChatGPT Health and how incorrectly it interprets wearable data, right? So in a nutshell, it's very much about the framing and then the guardrails.
Thank you, Julia. And I see Ushman from Dockhurst has got his hand up as well.
Hey, Lisa. I'd just like to add a couple of things to the process that helped us very much. First of all, it was choosing the correct agent and the internal feedback, internal testing that helps us a lot. And the second thing was the negative prompting of hallucinations. That was, I would say that was game changing for us. And one of the third things to kind of like gauge the user's trust and to also align the users, the expectations as well. What we did is we have put in a disclaimer that this is a non-emergency contact and it's a LLM produced generated answers. So they know that if there's some sort of an emergency, they're routed to an operator, and we have given that option everywhere. So the negative prompting and the disclaimer, those were the two big changing things for us that kind of like helped us with the medical accuracy. And then of course the agents, choosing a correct agent and prompting the correct agent, how it is, as Mert mentioned, using the different 5.1, 4.0 mini, those type of things, they work really well.
Fantastic. Thank you, Ushman. I'm sure there's lots of questions coming, but I want to make sure that everyone gets an equal share. So Indrani, if I can ask you to share the next video, please, for the next 3 organizations. Thank you.
Hi, I'm Sabine Fatma Haq and one of the co-founders at Doctors. In Pakistan, 3 out of 4 medical school graduates are women. Yet they get sidelined due to social cultural constraints, and only 1 goes on to practice medicine. Meanwhile, we have over 190 million who lack access to basic, affordable healthcare, especially women and girls. So we reintegrate qualified healthcare providers and connect them with underserved communities via technology. The results? We've impacted more than 5.2 million lives. We have 3 market segments: corporate health, where we work with large companies who finance healthcare for blue-collar workers and their value chain, factory workers, farmers, distributors, populations who have never had access to health insurance and disease management programs before. In last-mile rural communities, frontline health workers connect their villages to our providers via telemedicine. These programs are usually with government in climate-affected areas, and we focus on maternal and child health. Lastly, we work with pharmaceutical and diagnostic companies for consumer health activations and health awareness for the masses. There were a lot of possibilities with chat, but we decided to simplify and start with our most basic problems first. Number 1, we wanted to streamline communication, operational hours, and all of the coordination that happens between patients and providers. Number 2, we wanted to launch a WhatsApp first service layer where we could bring our users, gain their trust, and then build on that, eventually redirecting them here for all of their healthcare and insurance needs. And number 3, we wanted to introduce voice in AI and test it out with patients who are unable to read and write and engage them in their local language. Quick learnings. Number 1, unlearning is much harder than learning new behavior. We had to engage and redirect our users from helpline to chat. But once they saw the power and how effective the product was, they were sold. Number 2, AI is wonderful, but localization takes time, language, context. You need to build time for this. Lastly, trust transcends technology. There will be hiccups, but if we meet our users where they're at and inspire trust, they will stay the course. Some of our impact numbers are shown on this slide. What was really important for us was to test with different users: tech-savvy users, users who had high trust with us, new users, and even those who couldn't read and write. What we saw across the board is high adoption, repeat utilization, and completion in our service journeys. At an organizational level, we saw improvement in productivity and service reach, and this has opened up vistas for us to grow and scale exponentially with chat and AI. We're excited to unleash all of the things that we've been building behind the scenes. On the B2B side, we now have a single integrated platform for our users. This is going to help us scale faster, get more customers, and drive better health outcomes. On the B2G side, voice-enabled chat is a game changer. We look forward to scaling up our government partnerships and reaching more low-income communities. And on the B2C side, we're about to launch a nationwide health campaign with a pharmaceutical giant. We're going to be tackling taboo topics using chat and AI. Thank you so much, Turn.io, for believing in us. Let's continue to turn and rewrite the future of healthcare together.
Hi, this is Salma from Helium Doc, and that is not my voice. Helium Doc is a doctor booking platform serving more than 330,000 patients and more than 100 clinics average per month in the Middle East and Africa. One of our biggest challenges is no-show. Only 49% of patients attend their booked appointments, with many cancel last minute for unknown reasons. So we built Appointment Manager within Turn.io, and 38% of daily appointments are being booked through WhatsApp. We built end-to-end doctor visit journeys to improve conversions, retention, and enhance our data quality. Our performance in 1 month, more than 5,500 engagements and new interactions. 1 in 3 patients confirmed their booked appointments and improved conversions. 18.6% of patients rescheduled before their booked appointments, which increased retention. 11.5% proactively canceled before their booked appointments, which minimized no-shows. And 1.9% reported whether cancellation was made by the patient or by the clinic. 62% of patients shared their cancellation reasons. 30% shared their attendance status post-appointment, and 4.3% shared why they did not show up. 6% rescheduled after they did not show up, which increased retention too. Since more than 38% of daily appointments are being booked through WhatsApp, we built Book a Doctor via WhatsApp. The initial interest was 81%. 73% selected specialty, and 31% preferred completing their booked appointments on WhatsApp. More than 27% of patients don't know which specialty they should go to. So we built a symptom checker, which understands patient symptoms, recommend the right specialty, and help them book the right doctor and get the right care. 94% of users engaged with Symptom Checker AI bot received guidance and proceeded to book an appointment. So what did we learn? WhatsApp is the next Instagram for business. It's very powerful, not only for engagement, but to impact the business. High tech meets human empathy. Conversation design was a program hit. How we customized our tech stack to integrate with different technologies. And Turn Inbox can replace a lot of help desk features and maybe reduce cost. Our go-to-market includes Helium Doc WhatsApp icon on our homepage that drives visitors to start a conversation, using Turn reminders as a lead generation media channel, and Meta Click to WhatsApp ads. 2026 roadmap, micro consultation for gynecologists and pediatrics patients, the existing ones, healthcare management, medical health record, prescription, and beyond, empathetic bot that detects and validates emotions while breaking down mental and physical health concerns, and full automation, registration, and instant booking all happens within WhatsApp.
100 million sub-Saharan Africans live in healthcare black holes, far from the nearest health centre. One Day Health provides good quality healthcare to these communities for the first time. Some of the cheapest healthcare in the world for the people who need it the most. And we're proud to have launched 75 One Day Health centres, which have treated 412,000 patients at just $2 treatment. But access is only half the problem. Even harder is getting the treatment right. Each year around the world, 5 million people die because of low-quality treatment. Their clinician got the treatment wrong. And research shows that in low-income countries, under half of the patients are treated correctly. It's a coin toss. And it's a struggle for us at One Day Health too. Our nurses use strict guidelines, but we still make too many mistakes. So we've partnered with Turn to build One Day Guide, a clinical chatbot which helps our nurses treat our patients better. We've constrained One Day Guide to only use our validated guidelines, not the internet. After consulting their patient, our nurses talk with the One Day Guide for just 2 minutes, faster than their paper guidelines. The tool then shows the correct treatment and the information for the patient straight from our guidelines. There's 3 big benefits. First is obvious. Our patients can get better treatment. Second is constant learning. Our AI tool reminds nurses of the questions and exams that they've missed so they can continuously learn and remember. Third is individualized feedback. Through the Turn platform, we can see how every nurse thinks as they talk with the AI, and we can use this to individualize our feedback for each nurse. Of course, there's been challenges too. The big one has been getting our nurses to use it properly. The tool's on WhatsApp, yes, but an AI tool is still very foreign to our nurses and a big change to the paper guidelines we've been using for years. This is a clinical tool. So we've been cautious and done a lot of testing with 107 nurses in different settings, and our tool is now ready. 10 nurses are using it right now to treat over 800 patients in the last month. But us in Turn aren't the only excited ones. We're working with the London School of Economics to study the impact of One Day Guide. Half our nurses will use the chatbot and half of them won't. And we'll see how the tool improves patient care. And after that randomized control trial, we'll roll out the tool. And by the end of 2026, 50 nurses will use One Day Guide to help them treat 50,000 patients this year. But the potential's so much bigger. After we get evidence that a simple, constrained AI tool can improve patient care, we can help millions of nurses across rural sub-Saharan Africa to ask the right questions, to make the right diagnosis, and move closer to our dream that one day everyone in sub-Saharan Africa will access quality healthcare.
Fantastic. Another great batch of demos. I do need to just say all three of those organizations were truly committed. Nick and the team at One Day didn't have the internet for most of last week. Salma has lost her voice this week, and Sabine has been in hospital, and they all managed to pull the demo still together. So just a special shout out to the entire cohort that's just gone above and beyond. So now questions for them, for One Day, and also for Doc Hers and Helium Health. Let me have a quick look. Feel free to just raise your hand if you've got a question. Sarah, yes, go ahead, unmute yourself.
I'm bubbling with so many of curiosity and excitement, but and this extends not just to the former batch, this batch, or the one to come. To anybody who wants to answer, I'm curious because there's so many learnings and so much progress. Was there anything that you learned from a fellow peer that you were then able to kind of translate into your specific project? Yeah, just curious.
I'll take that one, Lisa, if that's okay. Okay, so yeah, in the beginning, we have a very protecting privacy laws and protecting everyone's information, because we are also going towards a digital health financing system on the WhatsApp as well. So we learned from, I think it was Kitanme, based from Mexico, their OTP recognition and their recognition their peers or their user from their current database. So that was a very valid point for us, and then we implemented that into our universe. So that was kind of like a one-step learning from them, from the cohort.
Thank you, Esmond.
I'm gonna, on Salma's behalf, I'll be her voice for today, as she has none. Salma says she learned so much from the entire cohort. Best practice, what's worked and what hasn't worked. And just adding to that, I can attest there's definitely a group set up, a lot of shares. But Tertia, I see you've got your hand up. Maybe you want to answer that one as well?
Yeah, I think there's so many things, but it was one of the highlights of the cohort was to learn from the others as well. And like every week when we share, we're like, oh, wow, we didn't think of that. Especially like the one day we saw how they actually use taking a photograph and then having the meal, analyzed, and we like, oh, that can be a solution for us also to take a photo of the hearing aid and AI to interpret which type of hearing aid that is and how we can help, because users don't always know how to say which type of aid they have. So that was also just one example. And some of the very clever teams here also gave us lots of ideas for the AI agents and using different models that they have tested much more than we have. So that was a great opportunity to learn. Thanks.
Brilliant. Pippa, I see you've got your hand up.
Yeah, thanks, Lisa. My question for you guys, technology is often not the hardest part of this. It's all the change management, getting in the health worker space, getting your health workers to start to adapt these tools, or your patients to kind of use these as the defaults. And there's often a moment, I know you guys did a lot of user testing during this process, there's often a moment where you can see that someone all of a sudden gets it and gets a value. I'd love to hear some of those stories from the cohort around like what was it that really clicked to get the types of results you guys have, which are incredible.
Yeah, can I jump in? Sorry, hands up, I'll jump in. For us, amazing thing was actually it sounds bizarre, but getting on a WhatsApp call and actually showing people using the tool. like showing them, we're talking into it. Here's the thing. These are the questions. Here's the diagnosis. And there was a couple of our nurses who the idea of this is so foreign, and they sort of like, oh my goodness, this can actually work. And then we saw the next day through the Turn platform that they'll actually start using it, after a demonstration. And it's a good thing about the Turn platform that you can immediately see how many users are using it, right? And obviously we're starting with just these 10, and so we can see really clearly the feedback as to whether they're using it or not based on what we've done.
Neil, I see you've got your hand up. Go for it.
And this is actually maybe for Nick, but anybody can obviously answer. I think something that Tertia said, like seeing each other do stuff with AI, like somebody using an image for something, and there's just so much that you can do that you could never do before, right? But I was also wondering, Nick, in your guys, like in the diagnostic world, did you test a lot of models? Like, is there stuff that works better than others? Or is it sometimes that in primary care, the general LLMs do pretty fine? Because I think a lot of people have a big hesitancy towards AI, which we all rightfully should, right? But that thing of you saying, like, you could basically also flip a coin to know whether a patient is going to get the right treatment or not. So I'm just curious to hear a little bit on playing with these AI models. Did that happen, or is it like out of the box, they in primary healthcare are already valuable and helpful?
So thanks so much. There's quite a lot on that question, but just out of the box for us is completely not useful. So for a start, in most clinical settings, you have specific even words for the diagnosis. You have specific medications in your context, in your country. You have specific constraints. And we have our guidelines which encapsulate that. So our tool uses our guidelines, and then the answer at the end is straight from our guidelines. So it's heavily constrained using the LLM to use our guidelines. And second, in terms of trying AI tools, this is actually a big shout out to Fede from Turn, who whipped up a prototype for AI testing. So we use a system called LangWatch. We've made 150 cases, which is a start. We'll make more. And then we have one bot. One is like the nurse bot, and one is our tool bot. And so it goes through those 150 cases. And so we've tested OpenAI, Gemini through that bot. And that's really important. There's 3 things we get out of there. It's not only diagnostic accuracy, that's obviously really important, but also the time it takes. So we can see through those interactions immediately the average time, because our nurses can't talk for more than 10 seconds back and forth. And thirdly, the cost. So that actually tells us the average cost, of doing these different consultations with these different tests. And obviously models are changing all the time. So if we're going to actually have a clinical bot, if a model changes as things evolve, we have to be able to almost in real time be able to see whether these models are good enough. So I think bot on bot testing is a really good idea, and we've already made a really good start with that.
I love that. Thank you, Nick. For anyone interested, Nick is got a wealth of knowledge and experience that he can share with anyone. I might mention that we will make everyone's contact details available afterwards. So if there's any particular demo organization that you've spoken to that you thought, man, I need to connect more with them, please reach out to us. But Julia, I see you've got your hand up.
Yeah, so what we learned on that is that the model choice is not very important, and what's important is actually the constraints that you put into the solution. So things like the discipline of prompts, the tone, how you limit the tone, safety rules, and things like consistency and predictability are more important than intelligence and cleverness. So we really went away from just choosing the right model, but spend most of the time on how to design the actual product constraints.
Fantastic. Then Ushman from Darkhurst.
So I'd just like to add a little bit for model things. We did not had really good experience with AI being used as a medical prospect. The problem we faced was the localization, because we were delivering the data and we were delivering the information in the local language, that is Urdu and Punjabi and all of those. So what we found out that it was very, very difficult, and it wasn't accurate at all. It took a lot of prompting again and again and again to kind of, just come up to a certain point where it is able to deliver medically, contextually, and culturally accurate information in the local language, because we know AI is usually trained and is mostly trained on English diaspora. So that was a big problem and a big learning for us in this context. Initially, we were of the opinion that it will go all smoothly, but that was something that we learned along the way.
Thank you, Ushman, for that real and honest. I mean, this is why we have these sessions, is to learn from one another. Samir from Helium Health, go for it.
Yeah, so really first what we learned was also starting very simple. Initially, we started very complex. We had very complex workflows, and since we also had to integrate it with our core product, that was a bit scary. Some things were not working, but once we came back to just very simple processes, workflows, and get the first booking, seeing it in our back end, that was very exciting. So we could actually do it and then see that someone actually has successfully booked an appointment. Then we graduated to building more complex features, also playing around with the language, just starting first with us getting what we want as the output, and then eventually going to creating those guardrails for the AI to guide it through getting the right outcome, which is really, in our case, generally just booking an appointment. But then also in booking the appointment, just also try to be how to make the AI be empathetic, also use things like emojis and all that to make it more engaging. Those are some of the things that we found quite exciting.
Thank you, Samir. I see Sadaf's got your hand up. Sadaf, one of our old alumni from a previous accelerator. Go ahead and ask your question.
So, my name is Mubashir. I am with Circle, currently working on their AI model. So, actually, my question is, I am training a model on the Japanese AI model that they have done. They have trained the user with 200,000 endoscopic images and the patient result, and trained the data in healthcare sector with the accuracy of 94%, 98.6% from the public patient files and the imaging system. So my question is, I know we can use AI in Turn.io, but when it will be available to integrate our own models that we are going to train or we are training currently to reduce the overhead for AI or things like that. That way we can increase the accuracy, because the general model doesn't provide the most pinpointed diagnosis or for the disease. That way we can also increase the situation, because now the more and more open source models are available that can be fine tuned and trained. Because currently I'm testing an AI model with 70 billion parameters using Air LLM, which is a layer by layer approach, and then combining it with VLLM, that is parallel learning large language model, to reduce the overhead and increase the efficiency. So we need to, what the question actually was, how can we integrate that? Because there is no API support for the external AI models, but we can still use ChatGPT and other Gemini models as well. So my question is that.
Anyone from the code wanting to take that one? Ushman, I saw you here nodding your head there.
The question makes a lot of sense, and being a doctor myself, this is a really accurate problem, and this is what we do in AI and artificial neural networking and computational CNN modeling. So that's a pretty good thing that's going on around in the world of AI, but I find it a little bit hard that I haven't explored it personally, because that's not our diaspora but that's a really interesting point, and I'll probably connect with Mubashir on that later on, that what they're doing with their models. That's an interesting thing for me as a doctor.
Fantastic. Thanks for that, Ushman. I see Pascal, you've got your hand up.
Yeah, thanks so much. Pascal from a maternal health company in Kenya called Malaika. And we played a lot around the kind of WhatsApp business APIs a few years ago, and we had a few limitations that really kind of blocked us from then really scaling it. And maybe two I would like to mention. One is this 24-hour window, which made it difficult for us at the time to kind of play around with making it really seamless. And I'm not sure whether that's resolved in the meantime. And then the second point is also the pricing. That, of course, you're still dependent on Meta's pricing tiers. I think it has lowered a bit in the meantime, but I would love to hear any experiences on the kind of constraints that Meta puts here from a technological perspective, whether that was an issue for anyone or whether that's not an issue anymore, maybe.
Thank you, Pascal. Sabine, I see you've got your hand up. I take it you'd like to answer that question.
No, Lisa, I'm going to excuse myself. I was going to piggyback on something else. Please let someone else answer this and then I'll come back. Thank you.
Anyone want to, Pascal, maybe I should just add, as part of this accelerator, obviously there was some additional support also from the various partners. So I'm not sure if the team can handle the question specifically, but around, I see Simon's got his hand up. Simon, I don't know if you've got an answer on this, or I can also give you an answer on this.
I just wanted to weigh in on both last two questions. First one on the custom models, that was before this. We do support custom models, so if people have their own models, largely the specification that OpenAI has created originally for the chat completion type of integrations has been adopted by the industry. So congratulations on OpenAI on forging that standard. And so any model that supports that API specification, we can integrate with today. So if any of you have your own models that you want to run, we can help you find a hosting environment that will run that model for you, and then you can integrate it with Turn, which is important and exciting. On the 24-hour window question that was asked earlier, that is enforced by Meta. That is not a Turn limitation at all at the moment. And careful design and around that is probably the best advice that we can give at this point. It's been designed specifically to ensure that WhatsApp remains a really high quality engagement platform, because if you do not allow that, we are all health organizations and we are inclined to think that all of our messages are equally important to the end user. Reality is end users may think quite differently about this. And so careful design is in place to make sure that we send messages that are aligned with the consent that the end user gives us. And I think Meta's 24-hour window is sometimes a very blunt hammer, but it is a blunt instrument that prefers a quality experience for the end user, which I think at this point in time, for many of these emerging technologies, is actually a really good limitation to enforce. And so within those constraints, I think it's on us as practitioners to think creatively and how do we do this in a way that's respectful, that provides a really great end user experience. On the cost question, I would defer to Pippa on that one. There are different models that we are looking at in looking at this. But super happy to see you on this call, Malaika, as a team. We met in Nairobi. We love what you do, and we'd love to see Turn continue to provide options for you all.
Thank you, Simon. One last question before we move on to the last batch. Sabine, if you want to get back to that answer that you were comment.
Sure, thank you. I just wanted to add in quickly. I know we've spoken about when working with AI, we've looked at localization and languages. For us, there were a few other things also. The gender perspective was really important, especially when we look at women's health and ensuring that when we are using AI, that's really built in to our answers and our solution. And then we are specifically tackling very taboo topics around sexual health, reproductive health. And it had to be curated in a very culturally sensitive way, right? Looking at culture and religion. So for us, it was a few things. Number one, does the gender aspect work? Number two, the culture, that landscape. And then, of course, introducing people to these topics is hard enough, and then bringing them into technology, right? So it's being delivered via technology. So adding all of those things and the human touch. So I think all of our cohort, there was so much learning when we were using AI and really what works in our specific context.
Fantastic. Thank you so much for that, Sabine. Now, for the last three, Indrani, I'm going to hand over to you, please.
I'm Yulia, the founder of Cliniva. Across Africa, 300 million women lack reliable access to primary care. And when primary care is weak, prevention is almost non-existent. In Kenya, only around 5% of young women have been screened for cervical cancer. And over a third of women are overweight or obese, increasing long-term risk for diabetes and hypertension. These are not problems of awareness. They are problems of follow-through. Cliniva was built to address exactly this gap. We provide primary and preventive care for women that is designed to be both high quality and scalable, not as one-off consultations, but as ongoing relationships. Our care model combines three things. We use a clinic-in-a-box approach to bring care closer to communities. We rely on nurse-led teams supported by strong protocols, because nurses are the backbone of African healthcare. And we use digital care to extend support beyond the physical visit. This model is already working. Today, we've reached over 60,000 women. 75% of patients return for follow-up care, and 9 out of 10 purchase preventive services. That tells us women value continuity, not just access. But prevention cannot scale through clinics alone. Behavior change doesn't happen in consultations. It happens in daily life when someone is busy, tired, or unsure what to do next. And that's where chat becomes essential. Through Ava, our WhatsApp-based coach, we help women turn clinical advice into small, realistic weekly goals. Ava answers everyday health questions, checks in gently to support follow-through, and even analyzes meal photos, not to count calories, but to give simple, practical feedback, like whether a meal is balanced and one small way to improve it. The goal is behavior change, not information overload. We start by embedding this coaching into our own clinics and WhatsApp follow-ups. From there, we scale through employers, insurers, and partners, reaching women who may never have consistent access to primary care. Our vision is continuous care between visits, a trusted health companion for women that supports prevention over time. Our belief is simple. Prevention only works if it fits into real life. Ava allows us to support behavior change where it actually happens, and to do it at scale for millions of women across Africa.
Hi, I'm Emanuela from MDAS. At MDAS, we built a network of diagnostic clinics across Nigeria. And in Nigeria today, 90% of people do not have health insurance, which means that most healthcare is paid for out of pocket, and it's expensive. The average doctor visit can cost 10,000 naira or more, which is over 10% of the monthly minimum wage. Most people resort to informal pharmacies or the internet instead of seeing a doctor. At MDAS, we've seen this problem up close. Patients delay care, skip follow-ups, not because they don't want to, but because the cost adds up quickly. We realized that while we were able to make diagnostics affordable, primary and ongoing care was still missing, which is why we created EasyLife, a simple, affordable healthcare membership built specifically for Nigerians without health insurance, helping Nigerians to seek professional care before self-diagnosing, delivered on WhatsApp, a platform people already use and trust, creating healthcare that meets people where they already are.
EasyLife members now have unlimited access to speak to a doctor throughout the year, either physically or virtually. They also have access to discounted tests and medications, discounted access to see a specialist, and also free dental and vision care. All of these under one annual membership that starts at 10,000 naira or $6 per year. To access these benefits, they simply have to send us a WhatsApp message, choose a plan that fits their needs, provide their personal details, and proceed to make payments for that plan. Once payment is confirmed, the user can then proceed to either book a consultation with a doctor either physically or virtually or via phone call. If they book a consultation to see a doctor, after successful booking, they get an email that confirms their booking, and also this booking gets added to their calendar, so they always get reminders, few minutes to the booking, and reminders are also sent on WhatsApp. aside from booking a doctor consultation, they will also have access to see our partner pharmacies that they can get their medications at discounted prices. Over the past 2 months, we've seen that 65 to 80% of our users preferred human interaction over AI interaction on WhatsApp. 58% of them chose to consult a doctor first when they had symptoms instead of self-medicating. And we saw 6 times improvement on patient follow-up. So people that came in to see a doctor the first time always came back for follow-up, either virtually or physically. And users were more willing to visit our verified pharmacies than any other pharmacy that they were previously going to.
So our go-to-market strategy would be to try to reach the target audience via digital channels. One of the ways we want to go about that is to use user-generated content. So that would be a mix of influencers and already existing users, just to kind of show and tell how they use the EasyLife service. Secondly, we want to run a digital campaign, so speak to a doctor in 5 minutes. So we envisage that sign up, onboarding to booking a consultation with a doctor should take about 5 minutes. So it's a campaign we want to run on social. Then lastly, email and WhatsApp campaigns. Currently, with our current partners, we have about 200K potential customers that we could reach. Running an email and WhatsApp campaign to those ones trying to convert them will be one way we go about it. For 2027, major goals, we want to be able to serve 1 million active customers. Also, language support. Currently, it's just English. We want to be able to offer the service in the 3 other major Nigerian languages, Igbo, Hausa, and Yoruba. And lastly, is to get about 5K more partners. So that's labs, pharmacies, lifestyle businesses, that's spas, gyms to come on board. And so we'll be able to offer more value to our customers.
Hi everyone, this is Fernando Chavez, co-founder and CPO at Cuéntame. Cuéntame is a B2B mental health platform for Latin America. We started Cuéntame after realizing that the problem with mental health is not a lack of care, it's a problem with the access. Right now, companies face massive hidden costs due to mental health. More than 30% of the workplace accidents are due to work-related stress. More than 90% of the sales team have reported to feel burnout. And more than 25% of voluntary resignations are due to mental health concerns. Right now, solutions focus only on reacting but not in preventing, and this means giving access. And let's be honest, mental health in Latin America has a completely different context. We still have stigma, big digital access gaps, long workdays. We're very exposed to traumatic events such as a robbery, and on the other hand, the government is still working on giving access to workers to mental health programs. And that's why we built Cuéntame, to provide a comprehensive corporate mental health solution. Today, we have impacted the life of more than 150,000 lives. We have decreased more than 50% the voluntary turnover, and we have worked with leading companies into the region, such as Nestlé, Danone, Natura, El Aeropuerto El Dorado, one of the main airports in the region. Our solution combines personalization, clinically effective resources, and data to prove return on investment. And here's one more truth. There is one group that is constantly being left behind: operational workers. Companies face difficulties reaching them, not for a lack of care. It's because the way they want to provide access doesn't match their reality. They face high level of stress, long shifts, and probably don't have computer, Wi-Fi, or even a corporate email. And let's be honest, reaching operational workers is one of the main challenges for mental health. In Cuéntame, 1 out of 3 users are operational workers, and this is not an accident. It's a sign out that when the access works, they will show up. And for us, the onboarding is where the magic begins. That is why we redesigned our onboarding using artificial intelligence and one of the main services that they constantly use, WhatsApp. From the first message, we guide people to the sign-up process, the first steps, and to measure their stress early. And with this, guide them to the right path. Everything here is designed to reduce friction from the first message, and we are reimagining the access to mental health through WhatsApp. Where are we now? We have implemented the sign-up process, the stress level measurement, and finally, the first recommendations and the follow-ups. And where are we going? Full management of therapy, booking, and payment. We are also implementing crisis management tools, and finally, early stress detection and content recommendation. In our onboarding pilot, we have seen strong signals that this is working. The sign-up process completion has doubled, and the stress index completion has reached 100%. And now we are getting ready to deploy this solution to our clients. And if you want to try our demo, please scan this QR. And finally, I want to say thank you to Turn.io because they allow us to scale access without losing empathy. Meet our users where they already are, especially those who have been historically excluded. So join us and remove every barrier to mental health. Thank you.
Fantastic. Well done to the last three teams. Now time for questions. There's questions for Clineva, Quantame, or MDAS. I have a question for Clineva. What was the most unexpected challenge in building and deploying your AI-powered service, specifically in a real healthcare setting? It's one thing to build a service isolated in pilot mode, but to actually take it right into the hands of users. Would you like to share some learnings there with us?
Yeah, I absolutely would love to. So something we learned and that surprised us on day one of deployment is that intelligence is not a problem. It stops being a bottleneck very early on, immediately. And what was more important is how the AI, the chat solution fits into the real life. So things like timing, emotional state, tone. So to give an example, we saw that exactly the same advice, same words, same logic, same everything, can be ignored by someone at 8 a.m., but then at 7 p.m., it would be followed, just because this is actually the time when someone is at home, maybe tired, and deciding what to eat for dinner or what to cook for dinner. Another example is when in the beginning we really were trying to be impressive and sophisticated, and so gave people a lot of smart options, which is technically great, but then people froze. They didn't know what to do with that. And then we reduced it to very simple, very small choices with very smart follow-through that was personalized. So much less intelligence, a lot more action. And once we've done that, the trust and follow-through improved significantly. And so I think that what we learned is that AI is uniquely positioned to learn about the small things that are different for everyone, and then support people in a way where it's just impossible for a human doctor to do or for just a digital health solution to do. And that it's actually more of a relationship with AI rather than software. And then relationships work when small details are right and contextual.
Fantastic. Thank you, Julia. Any questions maybe for the MDAS team or Quantame team? I see, Rubaiyat. I see you've got a question here. Do you want to unmute yourself and maybe just ask that? I'm also happy to read it.
Sure. Now, I was just wondering if anybody is getting good results with voice in any but the top languages, and whether users are actually even open to using voice messaging over WhatsApp.
Sorry, just to jump in here. Yes, users are very comfortable, at least here in Nigeria, they are very comfortable sending messages over WhatsApp. If anything, is the preferred mode of communication where people try to convey what's going on with them. So yes, we do have a journey where we try to use the AI bot to translate, convert speech to voice, and then that would help the AI to communicate what to do next. And yes, we did have some success with it, but over time we noticed that a lot of Nigerians in different parts of the country have accents, and that was getting harder to communicate. What we did was to have the AI kind of like translate it back to them and say, this is what you're asking, and then have them confirm and say, oh no, this is what I'm asking instead, and just continue with that along the lines. But yes, that's how we kind of moved around that situation. I don't know if that answers the question.
That's a great learning. But Nick, I see you shaking your head. Yes, and then no. Maybe you want to share
just
your learning.
100% agree. We haven't done nearly as much as Emanuela, but very small languages, hopeless. Like medium languages, okay. I love the way Emanuela is actually getting the feedback back and forth to kind of make it work. That's really good.
Ushman, yes, go ahead.
Yeah, we worked, I don't know whether it's going to answer, but it's a question or not, but like we worked with Urdu quite a lot. And that kind of like at the end of the cohort, at the end of the accelerator period, I would say by the mid of January, we perfected our coordinator agents. So it kind of like we experimented with feedback from our community users, from our community people from in the last mile setup, where women particularly don't have access to internet, don't have access to smartphone. So the literacy level, so it's very, very low. They prefer voice over chat. And each and every time when we asked for the feedback, it was in terms of a voice note, and it worked really well for us. It captured all the practical element. Yes, there are very, very certain nuances, like, errors in spelling and kind of like that. But we are recording it in Urdu, and that's what we had a good experience on that front with AI voice feedback.
Fantastic. Thank you, Ushman. Emanuela, I see you on my screen. I know that you did a lot of integrations. You had payment integrations, you had EMR integrations. How did it work for you? Was it easy? Was it not? What would you share with people?
Yeah, I mean, I wouldn't say it was easy, but I think it was doable thanks to the Turn team. I know I worked a lot with Manish. I think Manish was probably tired of hearing from me at this point, but yes, it was really important for us to have this aspect because we wanted people to make sure that it felt like they were carrying their healthcare along with them anywhere they went to, because it's really difficult to get access to healthcare quickly if you are like a low to middle income person in Nigeria. So yes, along the integrations, we're very particular about having people have quick access to their healthcare, which is why we're very big on integrating Health Pass, just so people can frequently have their files on hand with them. Currently in Nigeria, the way it works is, your data is in one hospital and that might not be the hospital that's closest to you, so you don't really know what's going on. So having them carry that around was super important for us. So, and we were able to work with Matt and kind of like customize what we wanted people to have with them, how to access it and how quick to see. And also with Paystack, I know initially Paystack wasn't supported on Turn, so we are very appreciative to Turn for allowing us to, bring in something new onto the platform. But Paystack was something that everybody uses and has different modes of, modes of accepting payments on Turn. So that was really helpful for us. People could transfer, pay with their card, use their bank app. So that was really important for us for people to have several options on how to access the care and make it even easier, which make the whole point is easy life. So the more easy it is, the better. But yeah.
Fantastic. Thank you for that. Any other questions from the audience to the cohort members? And this could be a question for any of the 9 that presented. It doesn't just have to be for the last 3. Sarah, yes. Go for it.
I was about to put it in the chat, but maybe just quickly, I'll say it here. More kind of overall, will there be a list of, organizations that are hoping to raise capital in terms of might be non-profit space? And then in the granting space, are there any collective or shared questions, research questions, hypotheses that you feel collectively really need to be prioritized by funders in the coming year?
That's a good question, Sarah. Who from the cohort would like to tackle that one?
Well, I can take a stab if that's okay.
Go for it, Harsh.
Yeah, so I'm not sure if it's a collective group question, but certainly we at WISE are facing one of those challenges, Sarah, which is especially in the healthcare space in EU, medical device licensing is a big blocker. And it almost prohibits us from entering the market where we can make the revenue. So it's a sort of chicken and egg situation where we need to have enough capital to go through that process and time to go through that process before we can enter the market. And that's something certainly that we hope there's more support for. It is, yeah, in the AI healthcare space, it's extremely prohibitive right now.
Thanks for that, Harsh. Julia, you've got your hand up as well there.
I also wouldn't risk saying it's a collective request, but two things come to mind. One is the whole context, so how to solve for context in our markets. Because all the LLMs have been trained on health behavioral data from developed countries, and ours is very different. And that's really at the core of creating trust with users. And we don't really see a solution here unless it's, spending a lot of money ourselves on training. The other one is around behavior change. So when we started designing our AI solution around behavior change, we actually found out that, and maybe there are behavioral scientists on the call who would disagree, but there's actually too little science behind that. Not enough research, not enough heuristics. And I think AI is, again, well positioned to just learn about that. And that's probably relevant across industries and across geographies, but really doing research on what drives behavior change in healthcare would be of great value to us.
Thank you, Julia. I see in the chat a question for Kwantame here as well. And Samir, I've just seen your hands, so I'll come back to you. But a quick question for Kwantame. There's actually two. The first is, in practice, how do you decide to escalate from an automated WhatsApp service to a human support service?
That's a great question, actually, because this was a big concern from our CEO and from some clients that reached out to us when we were presenting this demo with Turn. And what we're doing right now is we have, in several points, an AI agent that is analyzing the messages received from the user to try to identify if they are having a crisis right now. Because that was the main concern. What happens if you have an automated flow, but the user is writing like, I need help, I need your help, I'm having a crisis, right? So in several steps, we implemented these special agent blocks that are with LLM trained to, prompted to try to identify if the user needs urgent care, redirect to a human agent directly. That's what we're doing right now, and we have seen good results with that approach.
Amazing. Thank you, Enrique. Samir, yes, you hand your hand up next.
Yes, I wanted to talk more about the support. So especially when it comes to voice AI. So for Africa region, specifically for Nigeria, accents are very crucial. If you want to reach those audience, you have to speak in the tone that, they understand. Yes, they do understand English, but sometimes, the foreign accents is a bit difficult for them to understand. We're just figuring out how to make it simpler to localize it. We've done other projects where we had to do a lot of training, fine-tuning the accents, and some were more South African and less Nigerian. Maybe there's one Nigerian now that I've seen. In Nigeria also, there are different groups. So up north, they understand, so just making it easier to localize the accents, I think would be of great benefit.
Amazing. Very, very relevant indeed, Samir. Nick, I see you've got your hand up.
Yeah, I've got a bit of a response to Sarah, and I suppose a challenge to throw back at her as well on the question of support. And this is on the big AI labs, the big AI companies. At the moment, the costs for APIs are the same around the world. That's just what you pay for it. And over time, a lot of us, we're going to all be running directly to the AI company, say, can you help us with this? Can you give us grants? Can you give us discounts? And so I think some kind of coordination around not-for-profits and impact for-profits around pricing, like long-term pricing and support from the big AI companies. It's something that Turn can support with, people like Johnson & Johnson can support with. So we're not just all individually kind of looking for handouts or looking for help. So that's a challenge, kind of a coordination challenge I can throw back.
Thanks for that, Nick. Mert, you've got your hand up.
Yeah, it was two things. The first one, maybe if we're thinking about clinical AI products, one area I'd like to see more research in is human AI interaction after we move from being able to benchmark them at an accuracy level. How will this actually work when we integrate? And then a second one is actually maybe moving offline as well, having local models that can be run on smartphones in areas of low internet connectivity.
Amazing. And Tasha, I see you put one in a comment here. Do you want to maybe chat? Because I personally love that idea, but I'll leave it to you to raise that.
Sorry, Lisa, I'm trying to get my camera back. Sorry. Yes, I just feel that there's lots of opportunity, and what we are looking into definitely in this year is to do a couple of randomized control trials where we can really showcase the benefit of the AI-enabled health impact services and putting that against the traditional models and see what we can come up with. Yeah.
Amazing. I'm just looking through the chat here to see if there's any more questions. Let me have a look here. Then it's interesting. There's a question for Kwantame. With dealing with stigma or sensitive issues in WhatsApp specifically, what design choices helped users to feel safe to continue that conversation? I know Fernando Enrique wants to take that.
I think the right person. Go ahead, Fernando.
Yeah, what question is? So I'm trying to find it here in the chat.
Yeah,
I was
it's
answering
the
another
second
question.
last one. Yeah, I'll just repeat it. So, so it's not that one. When dealing with stigma or sensitive issues specifically, what design choices did you make to help users feel safe and encouraged throughout the conversation on chat?
Perfect. So we focus on two main things. One is reducing the emotional friction that the user may have, and the other is increasing the perceived safety from the first interaction. Doing things like using warm, non-clinical language, introducing sensitive questions gradually, not like all at the beginning. And with this, we have been like iterating with Stress Index, one of the indexes that we have been developing with the Inter-American Development Bank, and using like very soft language, very easy to understand. We have like a 12 question index, so we focus on reducing frictions, basically on and increase the safety on the first interaction.
Fantastic. Thank you, Fernando. Sabine, I see you've got your hand up, and I think I'm going to make that the last question for now. Want to make sure that we make it on time, but go.
Sure, and I'm sure a lot of us can connect afterwards on these questions as well. For us, when dealing with taboo topics and things like this, also for us it was important to build with the user. So we sat in the low-income communities, and when we're working through our models and the way we're going to respond, building with the users, sometimes building with community elders, just to kind of get their perspective as well. So it's actually made with them. And that really helped us because, it really helped us be able to respond in the way that made sense for them.
Amazing. Thank you so much for that, Sabine. I think that's a very, very relevant comment, that always putting the users first. I love in the comment section, I also see there's something already happening. Watch the space. We are going to be running a panel to run some RCTs. So yes, you heard it here first. More to come. But with that said, there is lots of thought-provoking ideas that you saw today. This is not the end. This is just the beginning. Lots of exciting work coming out of this cohort. We will be sharing all of the individual demos, also the contact details for everyone if you want to meet some of the team members, if you want to go through more detail of their use cases, and also test their actual WhatsApp services. We know we shared the QR codes in the presentations, but there's a lot going on. We want to make sure that you take your time to go through that. So with that, I'd like to hand over to Pippa Yates, one of our co-founders at Turn, to close it out for us.
Thanks, Lisa. And I just want to start by saying a huge congratulations to all our accelerator participants. My Turn team will laugh at me, but I'm either smiling or crying with emotion. And I found myself getting a little bit teary around like how incredible the work that you guys are all doing and have done over the last couple of months, and the ambition, 1 million screenings in a week. Love these numbers, and that ambition that's going to go forward here is super inspiring. And there are a couple of things I think were some patterns across what I heard today. I think the start simple and then iterate. Sarah from J&J started and said progress over perfection, and I think that's exactly the approach that all of these organizations have taken. They started with a simple use case, and then you can see how they iterated with user feedback already in the session and are going to as they continue to go more and more. I think Yulia, you said less intelligence, more action, which I think is exactly right. And giving things that are simple and easy for users to understand in the beginning is super helpful. And then we talked a lot about building trust, right? Building trust with AI, trust with your patients and how important that is. Transparency, rigorous evaluation, having human in the loop. Everyone, a lot of people this call first time hearing negative prompting. So a lot of interest in doing that, adding constraints, having short responses, narrowing the domain. And I think that's super important in terms of the relationships that you're also building with your patients, whether that needs to be doctor first before AI is super interesting insights around that relationship and building that trusted ongoing session with your users. And that, I think, Yulia, you said again, clarity and predictability are more important than cleverness in this space. And I think that those are the things that build trust. And last, we talked a little bit around a call out to the funders and the rest of the community around, smaller languages and the voice models are not yet that good enough for some of the clinical use cases, maybe some of the operational, but not the clinical. There's work to be done, and I think there's a race around all of these AI models that are going to push that. But there's a lot of testing to still be done to make sure that these services work well in smaller languages. And then secondly, we need more evidence, of AI plus WhatsApp in this healthcare space as we move forward, so we can all learn from each other. And Emanuela, you said, we need to give quick access to healthcare. And at Turn, we want to enable instant access to high quality healthcare. And that's why we're building these platforms. And it's in that light that I'm very excited to announce that we'll be running another Health Accelerator program focused on primary healthcare this year. And this 2026 Abundant Healthcare Accelerator will build on these learnings from this cohort to help a new group of participants scale practical, safe, and patient-centered digital care with a particular focus on self-care and care navigation. So please watch this space. Make sure you're following Turn.io and LinkedIn and looking at our website as we announce when you can apply for that. But very excited, and thanks again to the 2025 cohort. I'm super proud of the work you guys are doing, and onwards and upwards.
Fantastic. Thank you so much for that, Pippa. So, ladies and gentlemen, this is Demo Day 2026 coming to an end. It's been an absolute journey. It's been really amazing from a personal point of view, walking this path with every single one of these organizations. As I mentioned, this is not the end. This is only the beginning. Very exciting news that there is going to be another accelerator. So if you know someone or organization that could benefit and partake, please share the information with them. All formal applications will be shared on the Turn platform, so either on our social media. But thank you for your time today. We appreciate the work that we continue to do in partnership with Turn and our funders and our tech partners, and most of all, the participating organizations that join us through this accelerator. Stay well and stay healthy. Bye-bye, everyone.